2 times a week I try to drop him off. And I do have to modify my schedule in advance. It can be a little tricky to work that out, but I enjoy it. And I think he gets a sense that what I do at the hospital is important and helps people. When I went through interventional fellowship years and found out that I was pregnant. When I was about 25, 26 weeks pregnant, I went into spontaneous preterm labor. I decided that I would hold off on any major maternity leave until our son came home. I went back to work a week after he was born. To finish my fellowship, ICU unit where he was at was actually 1 floor above the cath lab. Well, I would come in, see him, and he was also breastfed the entire time he was in the hospital. And it was definitely a challenging time for us. The term work-life balance implies balance being equality, that one component of work versus one component of life are equally matched at all times. And I think that is unrealistic, which is why I try to favor the term integration. So for instance, if things are intense with my schedule, either in the cath lab or academically, for that time period. Oh. Thank you. In 2017, I started the Women's Heart Health Clinic. Part of what started was my experience with women in the cath lab. A lot of the women that I was seeing had stories where they were not adequately treated. Many of the women in clinic have been very grateful to have somebody that they can speak freely to and who will listen to them.
I had discomfort for a very long time, and I was just told that there was nothing wrong. Someone finally listened to me, and I'm forever grateful.
One of the things that I am most excited about is mentoring younger generations of trainees. Female fellows at small community programs will meet me and they just kind of stare at me because they've never met a female interventionist, and that just isn't a concept that they think really exists out there. Often we see very promising young female residents who are interested in cardiology. Invariably, we see that they don't apply, and it's because there's still this set perception that you just can't do all of it. It is doable to be a woman and a mother in our field. I often invite them to my clinic to also get some clinical experience. When you consider going into cardiology, you have to think 10 years from now, am I still going to be okay getting woken up at 2 a.m.? and not sleeping, an entire night. And really what drives that is your passion for what you do.